In 1932, hundreds of men in rural Alabama were promised free health care. What they got instead was a slow death. They were told they had bad blood. They were promised treatment. They were given hope. They received none of it. For 40 years, the United States government watched these men die. Not by accident, not by neglect, by design. This is a true story. This is the story of the Tuskegee study. Macon County, Alabama, 1932. The Great Depression had ravaged the South. Cotton prices collapsed. Banks failed. Sharecroppers who had nothing now had less than nothing. In Macon County, 82% of the population was black. Most had never seen a doctor in their lives. Life expectancy for a black man in rural Alabama was 48 years. For many, it was shorter. Syphilis was spreading. The disease moved silently through communities. People didn't understand it. They called it bad blood, a term that covered everything from anemia to fatigue to venereal disease. Bad blood. It could mean you were tired. It could mean you couldn't work. It could mean something was wrong inside your body that you couldn't see or name. The real numbers were staggering. Nearly a third of the black men in Macon County had syphilis. The disease was killing people, and no one was doing anything about it. Then, in the fall of 1932, the flyers began appearing. They showed up in churches, in cotton fields, on the walls of one-room schoolhouses. The black and white signs read, "Free blood test, free treatment, by county health department and government doctors. You may feel well and still have bad blood. Come and bring all your family." For sharecroppers who had nothing, this was salvation. Herman Shaw was 30 years old, a cotton farmer. He heard about the program at his church, Salmon Chapel. People said you could get free medicine, free examinations, things of that kind. So he went. Charles Pollard heard that men were receiving free physicals at a local one-room schoolhouse. He was in his 30s, a farmer like most men in the county. "So I went on over," he would remember decades later. "And they told me I had bad blood, and that's what they've been telling me ever since. They come around from time to time and check me over, and they say, 'Charlie, you've got bad blood.'" 600 black men signed up. They lined up outside clinics. They believed the government had finally come to help them. They were promised free medical examinations, hot meals, burial insurance, $50 to cover the cost of a casket and a grave. For men who worked the land from sunrise to sunset and still couldn't feed their families, this was everything. They trusted their government. They were wrong. The official name of the study was the Tuskegee Study of Untreated Syphilis in the Negro Male. Untreated. That was the key word. That was the entire point. The U.S. Public Health Service had a question. What happens when syphilis goes completely untreated? What does the disease do to the human body over time, from infection to madness to death to autopsy? To answer that question, they needed subjects, black subjects, poor subjects, subjects who would never know what was really happening to them. 399 men had syphilis, 201 did not. They would serve as the control group. The men with syphilis were never told they had the disease. They were told they had bad blood. They were told the government would cure them. The government had no intention of curing them. This wasn't a treatment program. It was an observation study. The Public Health Service wanted to document the natural progression of untreated syphilis, the way you might observe bacteria in a petri dish or mice in a laboratory cage. The men were the experiment. The men were the data. To run the study, the Public Health Service needed someone the men would trust, someone who looked like them, someone who could move between the world of white doctors and black sharecroppers. They found Eunice Rivers. Rivers was 33 years old, born in rural Georgia to a farming family. Her mother had died when she was 15. Her father worked double shifts at a sawmill to pay for her education, to give her something better than picking cotton. She had graduated from the Tuskegee Institute School of Nursing in 1922. She was one of only 4 black public health nurses in the entire state of Alabama. She had spent years traveling rural Alabama with the Tuskegee Movable School, teaching nutrition, hygiene, helping midwives, saving lives. She was trusted. She was respected. In the black community, they called her Nurse Rivers. She was someone who helped people. When the Great Depression wiped out her position with the State Health Department in 1931, She took a night shift at the John A. Andrew Hospital, the hospital that treated black patients. Then, in 1932, Dr. Eugene Dibble, a black physician who worked as a consultant on the study, recommended her for a new position. Scientific assistant for the U.S. Public Health Service, she took the job. For the next 40 years, Nurse Rivers would be the only consistent staff member of the Tuskegee study. Doctors came and went. Research directors changed. But Nurse Rivers stayed. She recruited the men. She kept them enrolled. She drove them to their appointments. She drew their blood. She comforted them when they were afraid. She dispensed aspirin and vitamin tonics, substances that did nothing for syphilis, but made the men believe they were being treated. She was the bridge, the liaison, the face they trusted. Years later, after it all came out, people would ask, how could she do it? How could a black nurse help destroy black men? But in 1932, during the Depression, when a quarter of the country was unemployed, Eunice Rivers had a job in her chosen profession. She had stability, she had purpose, and she believed, or told herself she believed, that she was helping. The doctors performed tests. They took blood samples. They measured the men's bodies like specimens. And then there were the spinal taps. The procedure was excruciating. A long needle inserted between the vertebrae, puncturing the membrane around the spinal cord, extracting cerebrospinal fluid. The men didn't know what it was. They called them back shots, or 606 shots, slang for salvarsan, an arsenic-based treatment that was sometimes used for syphilis in the 1920s. The men thought they were being treated. They thought the pain meant the medicine was working. They weren't being treated. The doctors were testing for neurosyphilis to see if the disease had spread to their brains and spinal cords. To convince the men to undergo the painful procedure, the Public Health Service sent letters, official letters, letters Babies infected in the womb, their tiny bodies already ravaged by a disease that could have been prevented. To ensure families would agree to autopsies, the government offered burial insurance. $50, enough for a casket and a grave, $50 in exchange for a dead man's body. The men didn't know they were dying for science. They thought the government cared about them. They thought Nurse Rivers cared about them, and in her way, perhaps she did. She called them her patients. She attended their funerals. She held their hands when they were frightened. But she never told them the truth. The study became routine. Every year or two, the men would be examined. Their blood would be drawn. Their symptoms would be recorded. By the 1950s, most Americans had forgotten about it. Medical journals published updates occasionally. A few researchers knew, but to the public, to the world, the Tuskegee study didn't exist. Charlie Pollard worked his farm. In 1958, he received a certificate and $25, compensation for being in the study for over 20 years. He hung the certificate on his wall. He was proud of it. He thought it meant something. Herman Shaw grew old. Every year, Nurse Rivers visited him. She called him by name. She asked about his family. She drove him to the hospital. Really and truly, she would say years later, when we were working with those people, that was the joy of my life. By the 1960s, the original researchers had retired or died. New doctors took over. They inherited a study that had been running for 3 decades. They saw no reason to stop it. In medical circles, the Tuskegee study was considered valuable. It provided longitudinal data, information about how syphilis progressed over decades. Papers were published, careers were built. No one asked if it was ethical. No one asked if the men had consented. No one seemed to care that penicillin had been available for 20 years. The study was almost complete. The men were dying. Soon there would be enough autopsies to finish the research, and still no one stopped them. It took 40 years, and one man to expose it. Peter Buxton was 28 years old in 1965 when he started working for the U.S. Public Health Service in San Francisco. He was an epidemiologist, tasked with tracking venereal diseases. One day, he overheard colleagues talking about a study in Alabama, a syphilis study, on black men who weren't being treated. Buxton couldn't believe it. This was the Public Health Service. They were supposed to protect people, not experiment on them. In November 1966, Buxton filed an official protest. He sent a letter to his superiors. He argued the study was unethical, that it violated basic human rights, that it needed to end immediately. His complaint was rejected. The study, they told him, was scientifically valuable. It was almost complete. Ending it now would waste 40 years of research. In 1967, Buxton was summoned to a meeting in Atlanta. Public Health Service officials sat across from him. They told him he was being impertinent. They defended the study. They insisted there was nothing wrong with it. One official would later claim, "There was no racial side to this, it just happened to be in a black community. I feel this was a perfectly straightforward study, perfectly ethical, with controls." Buxton left the room in disgust. He left the Public Health Service, he went to law school, but the study haunted him. For years he tried to get officials to listen. He wrote letters, he made calls, he pleaded with anyone who would hear him. No one would act. The men kept dying. The study continued. In 1972, Buxton had had enough. He reached out to Edith Lederer, a reporter with the Associated Press, an old friend, someone he trusted. He gave her everything: documents, records, correspondence, proof of what the government had been doing for 40 years. Lederer knew the story was enormous. She passed the documents to John Heller, an investigative reporter on the AP's Special Assignment Team. Heller was 29 years old. She was the only woman on the team. When she opened Buxton's files, she felt physically ill. "I didn't want the story to be true," she would say later. "I could not believe that that could go on in this country." But it was true. She spent weeks verifying every detail, calling the Public Health Service, interviewing officials, tracking down survivors. On July 25, 1972, her story appeared in the Washington Star. The headline, "Syphilis victims in U.S. study went untreated for 40 years." The next day, it was front-page news in the New York Times. America woke up to the truth. The reaction was immediate. Outrage, disbelief, horror. Senator Ted Kennedy called for congressional hearings. Television cameras descended on Tuskegee. Reporters tracked down survivors. Charlie Pollard, 66 years old, spoke to a reporter at his farm. He was dressed in blue overalls and a work shirt. He had just learned after 40 years that bad blood meant syphilis. "I understand work," he said, climbing onto his tractor. "All of the rest of this mess I don't understand." Dr. Donald Prince of the Centers for Disease Control called the study almost like genocide. The Public Health Service tried to defend itself. They said the study had been important, that the men would have died anyway, that the research had value. No one was buying it. In November 1972, 40 years after it began, the Tuskegee study was officially terminated. By then, 28 men had died directly from syphilis, 100 more had died from complications, 40 wives had been infected, 19 children had been born with the disease, 128 lives lost, countless others destroyed, and no one went to prison. Not a single doctor, not a single researcher, not a single official who knew what was happening and did nothing. In 1973, attorney Fred Gray filed a class action lawsuit on behalf of the survivors and their families. Fred Gray was a civil rights legend. He had represented Rosa Parks after she was arrested for refusing to give up her seat on a Montgomery bus in 1955. He had fought segregation across Alabama. Now he was fighting for the men of Tuskegee. Charlie Pollard was among those he represented. So was Herman Shaw. So were the families of men who had died, men who never knew they were being experimented on. The case was Pollard vs. United States. The government knew it would lose. The evidence was overwhelming. The outrage was universal. They settled. $10 million distributed among the victims. The Tuskegee Health Benefits Program was established to provide ongoing medical care and burial expenses. But there was no apology, no admission of wrongdoing, just money and silence. The study's impact extended far beyond Macon County. Medical researchers were forced to confront what had happened. How could doctors, people sworn to heal, deliberately withhold treatment? How could a study like this run for 40 years without anyone stopping it? How could so many people know and do nothing? In 1974, Congress passed the National Research Act. The law established institutional review boards to oversee human research. Informed consent became mandatory. In 1979, the federal government published the Belmont Report, establishing 3 core ethical principles for research: respect for persons, beneficence, and justice. The rules changed because of Tuskegee, but the damage was done. In black communities across America, trust in the medical system had been shattered. Tuskegee became a symbol, proof that the government would sacrifice black lives in the name of science. That mistrust persists today. When patients refuse treatment, when they question their doctors, when they say they don't trust the system, this is why. Tuskegee is not history. It is living memory. Years passed. The survivors grew old. Most of them died. Herman Shaw turned 90, then 91, then 92. He had lived most of his life carrying a secret shame, believing he had bad blood, believing there was something wrong with him that couldn't be fixed. Now he knew the truth. The government had lied to him for 40 years. In the 1990s, a group of doctors and medical ethicists formed the Tuskegee Syphilis Study Legacy Committee. They had 2 goals. First, the President of the United States should publicly apologize to the survivors and their community. Second, a permanent memorial should be established to honor the victims and ensure this never happens again. Though it took years, but finally in 1997, President Bill Clinton agreed. On May 16, 1997, 5 survivors traveled to Washington, D.C. Herman Shaw, 94 years old, Charlie Pollard, 91, Carter Howard, Fred Simmons, who thought he was about 110 and had taken his first airplane ride to be there, Frederick Moss. 3 other survivors were too ill to attend. They sent family members in their place. Sam Donor was represented by his daughter, Gwendolyn Cox, Ernest Hendon by his brother, North Hendon, George Key by his grandson, Christopher Monroe. They gathered in the East Room of the White House. President Clinton stood at the podium. He wiped a tear from his eye as he began to speak. The 8 men who are survivors of the syphilis study at Tuskegee are a living link to a time not so very long ago that many Americans would prefer not to remember, but we dare not forget. It was a time when our nation failed to live up to its ideals, when our nation broke the trust with our people that is the very foundation of our democracy. Medical people are supposed to help when we need care, but even once a cure was discovered, they were denied help and they were lied to by their government. Our government is supposed to protect the rights of its citizens. Their rights were trampled upon. 40 years, hundreds of men betrayed, along with their wives and children, along with the community in Macon County, Alabama, the city of Tuskegee, the fine university there, and the larger African-American community. The United States government did something that was wrong, deeply, profoundly, morally wrong. It was an outrage to our commitment to integrity and equality for all our citizens. To the survivors, to the wives and family members, the children and the grandchildren, I say what you know. No power on earth can give you back the lives lost, the pain suffered, the years of internal torment and anguish. What was done cannot be undone. But we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry. The words came with pauses, emphasis on each one. Shameful.